Assalamu alaikum wa rahmatullahi wa barakatuh. We are learning ocular pharmacology, and today's topic is the therapeutic application of drugs in ophthalmology. What are the common ocular drugs? These are antibacterials, antivirals, antifungals, certain mydriatics and cycloplegic agents, drugs for anti-glaucoma medications, anti-inflammatory agents that include corticosteroids and shades, certain ocular lubricants, certain local anesthetic drugs, ocular diagnostic drugs, and the drugs that become toxic to eye that will cover into a ocular toxicology. These are some topical preparations for ophthalmic use. Example, erythromycin is available in 1% solution, and the toxicity is due to protons that the toxicity is the hypersensitivity to the eye, while DRCD is the drug-related corneal deposits. It is a drug that is used for the conjunctivitis. It is a macrolide that binds to 58 subunits of bacterial ribosomes, and it prevents the ribosomes from shuffling along and adding a new amino acid to the elongation of protein chains. These are protein synthesis inhibitors, a broad spectrum antibiotic, effective against effective against mainly respiratory tract infections. However, it is also effective against certain topical infections like staphylococci, enteric, GNRs, and anaerobes and enterococci. The side effects are mild. Mostly, the side effects are related to the GI tract or hepatic or cardiac system. And as we are using the drug through the eye, the side effects are very less, except hypersensitivity. Next is the erythromycin ointment. Belonging to the same class, but it has more toxic effects on the other organ system. However, in the eye, it is very effective. Again, hypersensitivity reactions are there, and then the indications for use are the superficial ocular infections, especially involving cornea or conjunctiva. Then we have agatifloxacin. It's fluoroquinolones. Fluoroquinolones inhibits the DNA topoisomerase enzymes that are involved in the winding and unwinding of the DNA, and it leads to the breakage of the DNA and death of the cells. 0.3% solution is available, and it is again a drug of choice for the conjunctivitis. Then gentamicin is available 0.3% solution. Again, hypersensitivity reactions are there for the eye. It is an aminoglycoside. It binds to the bacterial ribosomes, 38 subunits, and causing the misreading of the genetic code, leading to the incorrect protein formation that lead to the interruption of protein synthesis. Systemic effects are very much high, but in case of topical formulation, the adverse effects are very mild. वैसे तो ये nephrotoxic, ototoxic, and neurological toxic है. However, in the eye, it is very safe drug and a very effective drug used for the conjunctivitis and keratitis. Then we have levofloxacin. These drugs are arranged alphabetically. Levofloxacin is fluoroquinolones. 0.5% is available. Conjunctivitis. Then we have another strength of levofloxacin, which is the 15%, and it is used for the corneal ulcers. Moxifloxacin, another fluoroquinolones. It is available as 0.5% solutions. Ofloxacin, 0.3% solution. Tobramycin and aminoglycosides, 0.3% solution, and as well as 0.3% ointments is available. These are the classes that can be used topically for the bacterial infections, including penicillins, cephalosporins, sulfonamides, tetracyclines, chloramphnicols, aminoglycosides, chloroquinolones, vancomycin, and macrolides. The preferred route is the topically, either prophylaxically, preoperatively, and postoperatively, and number of ocular bacterial infections. These antibiotics are indicated. Starting from the amoxicillin, the combination will be there either with the clovilate or cipaclo to the intravenous use in the case of the orbital cellulitis. Other examples are gentamycin, cephalosporins, vancomycin that can be injected intravitreally for the treatment of endophthalmitis. Sulfonamides are mainly used for the chlamydial infections like trachoma, which includes the conjunctivitis and toxoplasmosis. Here we know that penicillin and cephalosporins both are bacterial cell wall synthesis inhibitors, and the coverage is that in case of cephalosporins we know that there are 5 generations: first generation, second generation, and third generation. First generation is specific for gram-positive foci like cefazolin. Second generation is for gram-negative and anti-staphylococcal cephalosporins like ciprofloxacin, and the third generation is meant for both type of microorganisms, more preferably gram-negative bacilli, ceftriaxones, as we all know that fifth and fourth and fifth generations are used for IV use, so topically they are not used. Allergic reactions are the most problem, and neutropenia and thrombocytopenia may also be occur. Well, aminoglycosides, as far as aminoglycosides are concerned, they are the inhibitor of bacterial protein synthesis, involve gentamycin, tropicamid, neomycin, and amikacin. Among them, neomycin is very toxic if it is taken by orally, so it is not available orally, only available in a optical or topical drugs. Tetracycline also inhibit the protein synthesis inhibitors, and they again effective against gram positive and gram negative, and the most important thing is that they are effective against gram negative along with fungi and chlamydia. Chloramphnicol against it is a bacteriostatic antibiotic. Coverage is very good, available in form of eye drop and eye ointments. Chloroquinolones is the most frequently used topical broad spectrum antibiotics. Examples are ciprofloxacin, ofloxacin, moxifloxacin, levofloxacin, and becifluoxacin. These are certain infections. You can see that trachoma that can be treated with the topically or systemic use of tetracyclines or erythromycins. There may be a bacterial keratitis, that is the corneal ulcers, can be used topically by cephalosporins, aminoglycosides, vancomycin, or fluoroquinolones. It totally depends upon the practice of the doctor. Bacterial conjunctivitis, it is a very, very common disorder, and it is self-limiting in most conditions. And the drug of first choice is the erythromycin. Then, if it is not effective, then it is substituted by aminoglycosides or fluoroquinolones or chloramphnicol. Dacrocystitis, another infection. It is an infection of lacrimal sacs. Nasolacrimal sacs की तरफ infection हो जाता है. That's lead to the dacrocystitis. Rhodilum style infection of the mole glands. अपर आप देख सकते हैं eyelid के ऊपर इसका एक infection आ गया है. Conjunctivitis, red eye, it is a common disorder. और यहाँ पे this is an inflammatory process of the conjunctiva. Blepharitis, it is a inflammatory process of the eyelids. कुछ की complete pharmacotherapy जो है वो share कर लेंगे. These are certain antiviral agents that are for ophthalmic use like trifluridine. Mostly viral infections are due to the herpes virus or varicella zoster virus. So in this case, acyclovir or valacyclovir and fencyclovir are the main choices that lead to the inhibition of viral synthesis. These drugs are nucleoside analog that after phosphorylation they get incorporated into the elongated viral DNA strand, and They are just like cellular nucleotides, but they lack the functional group that allows the next nucleotide to be added. So they stops the replication. जब ये ऐड हो जाएंगे तो फिर फर्दर न्यूक्लियोटाइड्स ऐड नहीं होंगे. स्ट्रक्चरली रिजेंबल है, फंक्शनली इसमें फर्दर एडिशंस नहीं हो सकता. इसलिए ये जो तीन है हमारे पास, एक साइक्लोवेल, वेलासाइक्लोवेल एंड साइक्लोवर, these are nucleosides analog. Trifluidine is a pyrimidine analog. It's also a nucleosidal analog and it is available only for optical use. GlaxoSmithKline का ही brand है and very effective. The major toxic effect of the trifluidine is the punctuate keratopathy and hypersensitivity reactions. Then other antiviral drugs are Fosanet, Genciclovir, Valganciclovir, and Cidofovir. Genciclovir, Valganciclovir, they are also a nucleoside analog that after phosphorylation is integrated into the viral DNA by DNA polymerase. The enzyme is DNA polymerase and it stops the viral replication, where Valganciclovir is a prodrug of Genciclovir. Cidofovir is also a nucleoside analog that has a similar mechanism to the Genciclovir, while Fosanet is a pyrophosphate analog that acts as a non-competitive inhibitor of the DNA and RNA polymerase of multiple viruses. The common mechanism is same, that all are nucleoside analog and they stop the viral replication. No certain ocular toxic effects are found in case of these drugs, and mostly these are administered in the intravitreal route, or either they are available in the as a form of implants, or oral or systematic use can be there. Among all them, acyclovir is the most common used antiviral drugs, as available as 3% ointment 5 times a day for the 10 to 14 days durations. 80 mg oral 5 times or 10 to 14 days available is for case of herpes zoster retinitis. Others are Dextroside, Biodacin, Cytarabine, Trifluorothymidine, Genciclovir, and you have to check out their mechanisms. It is the illustration of viral dendritic ulcer. Ulcer is created in the dendritic cells of the eye. This is the cyclomegalovirus retinitis. These are certain antifungal agents that are used for the ophthalmic use. Among them, a very common drug is the Amphotericin B, death of the fungal cells. However, it will take time and it will at least require 21 days treatment. Indicated for the yeast and fungal keratitis and endophthalmitis. Yeast and fungal endophthalmitis in lower and as well as in higher doses. Either it is available in solution in the conjunctival administration up to the 5 microgram for the intravitreal injections. Then we have Gentamycin. 5% topical suspension is available. Gentamycin also inhibits the ergosterol synthesis by inhibiting the transportation of glucose and protein in the fungal cells. Fluconazole are the azoles that are the mainstay of the antifungal pharmacotherapy. All azoles inhibit the fungal cytochrome P450, 14 alpha D-methylates, inhibiting the conversion of renosterol into the ergosterol. It means that they inhibit the synthesis of ergosterol through the enzyme P450, 14 alpha demethylase inhibition. So fluconazole, itraconazole, ketoconazole, meconazole, all are the blocker of the ergosterol synthesis. And again, these drugs are fungicidal, and these drugs have a very low potency of the adverse effects. They are most common use drugs.